Good morning and welcome. Today is the second day of Blood Cancer Awareness Month, and we are very pleased to be able to bring this webinar to you, Exploring Emotions, Blood Cancer in You. Firstly, I'd like to warmly invite Mr. Garry, a Minjibil elder, to do acknowledgement of country.
Jingari, hello, and Jingawala, welcome. I'd like to acknowledge all Aboriginal people on this wonderful country we live on. I'd also like to acknowledge the elders and my ancestors for the hard work they've done to persevere through deprivation of liberty and loss of land, to persevere for me to be here today. I'd also like to acknowledge the young ones, our Jarjums, the ones that are watching our moves, our next leaders in this wonderful land we live on. This is a wonderful thing we're doing today, and I'm so proud to be here. So, Jingawala, welcome.
Thank you, Garry. In today's webinar, we will be exploring some of the common personal reactions and experiences that accompany life with blood cancer. These might impact our emotions, adjustment, expectations, and our overall health, well-being, and quality of life. These challenges can change how you feel and think about yourself and about your own life. Really, no matter how long you've been living with blood cancer or what stage of life you're at. We'll also be exploring some practical strategies to help overcome some of these challenges. So to start, we'd like to share the story of Mr. Garry Kafoa, Minjibil elder and blood cancer survivor. Garry will share his incredible story of the highs and lows and what has helped him through life with blood cancer.
Hi, Jingari, hello. My name's Garry Kafoa and I am a Minjibil elder from Tweed Heads, part of the Bundjalung Nation. And at the age of 44, I was diagnosed with blood cancer called acute myeloid leukemia. Before diagnosis, I was a professional fisherman, and I had 5 or 6 men underneath me working for me. We had an Indigenous crew. Life was great. In the sun every day, out in the open, sleeping on the beaches miles from any town. Just have that freedom. I was born in a very lucky time. The first signs that I had of something wasn't right was to be a fisherman, you had to be pretty strong. It's a pretty hard game. And one day I was pulling in the net and I just felt it just wasn't as easy as it was yesterday. And I just thought to myself, oh, that'll just blow over, I don't know. But the next day it became harder again, and then harder again. My partner at the time made me go and have blood tests done, and the hospital rang me straight away and said, come straight over. When I first got the diagnosis at the hospital, there was a young doctor there, and she came up and she said to me, you've got acute myeloid leukemia, it's well advanced and your chances aren't great. So if I was you, I would get your life in order. And then there was a young male doctor standing nearby, and when she left, he came over and said, no, come over here, I want to talk to you. And he sat me down on one of the beds, got his pen out, and he drew all over the sheet too, which was like, he just explained it all. And he said, you've got a good chance. You've got a good chance. I'll never forget that. First lot of chemo I had was pretty strong. And I got the shakes, like the Rigors, and I got everything you could think of. One time in hospital, I was asleep and I woke up, and there was a young doctor sitting at the end of the bed, and I could hear him talking on the phone. He said, oh, this man is so ill, I'm really worried. And then I looked at him and I said, am I going to make it? And he goes, oh, most definitely. I said, well, yeah, I didn't hear that on the phone before. Things really changed while I was having treatment. You know, I was a man that was born to be underneath the sun. Like I spent all my life underneath the sun, underneath the stars, to now being in a bed My wife at that time she would come up quite a bit, and she'd bring my daughter. At that time she was 4. She didn't really know what was going on. She just knew that Dad was sick. You could go up to this window at the end, and you could look down at the car park, and I could see them walk across and get in the car, and that's when it really hit home, that freedom, that life that I had. It was pretty much, at that stage, it was pretty much gone. So I had to readjust. My brother was he was the one that gave me the bone marrow, and I was very lucky. I have, there's 6 siblings, and my brother, there's 20 years difference between us. My specialist said, look, you've got to cross all the T's and dot the I's to have a transplant. And he said, and your brother, it's like you were twins. You're just spot on. I can remember the day they brought the bone marrow in. It was in a big bag, and 2 nurses brought it in and put it up. And when I saw the doctor came in, he said, did you see the size of that bag? And I said, yeah. And he said, usually the bag's like that. He said, your brother had so much marrow, it was unbelievable. I was told I was in remission, and that made me, it was unbelievable. But it wasn't something I didn't expect, because I always thought, I'm going to beat this. You know, it's just another hurdle I'm going to get over. So when they told me that, it was a great feeling. It was strange though, because I couldn't be a fisherman anymore. So that life that I knew, even when I beat leukemia and went home, the life that I knew was over. And I become pretty depressed. No one can really understand that, because they're like, but you've beaten leukemia. You've got all your family around you. But that sadness of losing what I've had since I was a little boy, that depression, it took me a long time to get over that. To have blood cancer can bring isolation. You can feel alone. For me personally, it gave me time to think a lot about my life before I was diagnosed, and how I can change my life and for the better when I get out. And for me, it was about helping people. That's all I want to do, is help people. I just have this real empathy for people that are doing it tough, physically, mentally. I was a Aboriginal and Torres Strait Islander drug and alcohol caseworker and wellbeing worker for 7 years. I had many clients that were going through trauma, and in that trauma, the only way they thought they could cope was through drug and alcohol. And then they would get themselves into some trouble, or they'd get really sick. And so just to bring that positive energy that there's always hope.
Thank you so much, Garry, for so eloquently sharing your story. You know, and particularly, I think what it highlighted was those really common themes that we hear so much around adjustment and loss and also hope. Would you like to comment or add to round out what we've just heard?
From the moment I was diagnosed, I never gave up hope. It never entered my mind at all. Even in the toughest times, when I did become very unwell while I was in hospital, and but you know, I had great support with my family around me, and just that, you know, just never giving up hope. It never entered my mind never at one point. I always had it in my mind that this was something that I was going to get over. I was going to get better, and that's what stuck in my head the whole time through the journey.
Thank you, and I think that's a really important message. And but also, you know, the highs and the lows, but that one thing held you steady throughout that experience. So Thank you so much.
No, you're welcome.
I'd like to take this opportunity to introduce our next speaker, Dr. Charlotte Tottman, who works as a clinical psycho-oncologist. She consults privately, providing psychological treatment for cancer-related distress. Charlotte works with cancer patients, their family members and carers at all stages of their cancer experience. Charlotte works closely with the Breast Cancer Network of Australia, is an editor for the Cancer Council of Australia, and has strong links with the McGrath Foundation, Canteen, Leukaemia Foundation, and Ovarian Cancer Australia. Thank you so much, Charlotte, for being with us today.
That's a pleasure. It's lovely to be with you. Just before I go on, I just want to acknowledge Garry's contribution, and he's just such a fabulous living, breathing example of probably a lot of what I'm going to cover today. So it was great to have that as kind of like setting the scene. Thanks very much, Garry. That was very moving, and I think probably very relatable to a lot of people. All right, so yes, my name's Charlotte Tottman, and I'm a psycho-oncologist, just sexy language for a clinical psychologist specialising in cancer-related distress. I'm going to talk to everyone today from three perspectives. One is the theory behind psycho-oncology. The other is the clinical practice and experience that I have working in the field for a long time. And the other is my own personal experience, not of blood cancer, but of breast cancer. Quite a long time after I started working in the cancer space, I was diagnosed in 2018 with breast cancer. And so while it's definitely not the same experience as a blood cancer diagnosis and treatment, I guess there are some similarities, particularly the stuff of being on the other side of the fence, experiencing that diagnosis and then the treatment and then the aftermath. And so I guess that gives me just another bit of insight into what it's really like for my clients and for other people out there going through a cancer experience. They're my contact details. I'm very available. You can find me on the net. You can email me or message me or research me if you want to. So for anyone who wants them, there they are. Before I go any further, just a trigger warning. Today, I'm going to cover a lot of detailed information about psychological responses to a cancer experience, and it can bring up stuff for people. It can make you feel and think things. And if you do feel a bit wobbly afterwards, then it shouldn't last long. It might last the rest of the day at max, but it shouldn't last longer than that. And if you are noticing that you're kind of feeling a bit shaken up, it's a really good idea to just touch base with someone that you trust and just have a bit of a debrief about like what it might have been that it brought up for you and why you might be feeling a bit on edge. The first thing that I wanted to start with was this thing that I call the stool analogy, not the other sort of stool. And this is something that I use to just explain why people might struggle psychologically during and after a cancer experience. So the analogy goes like this. If you think of the seat of the stool as your psychological well-being is supported by a number of legs. And typically for most people, they include family, friends, hobbies and interests, work and study, physical health and healthy lifestyle behaviours. Now, some people have a lot more legs than that on their stool, but most people have those five. And what happens when you get a diagnosis of cancer is that the legs on your stool start to either get whittled away or they actually fall off the stool. And so what happens, you can see the seat on the stool starts to tip, and that's your psychological well-being. So if you have felt or you are feeling like maybe you're not feeling as stable as you used to, there's a really good reason for it. And that's because all of those things that were keeping your stool stable, your psychological well-being stable, aren't the same or they aren't there at the moment. So today I'm going to talk about a number of things, and these include diagnosis shock, emotional isolation, relationship changes, ongoing adjustment, some of the common psychological responses, and 5 quick strategies at the end that are helpful in navigating some of this space. So diagnosis shock. Anyone who's watching this will probably remember the feeling of being diagnosed. For a lot of my clients, they feel like it almost divides their life in two, almost like there was life before diagnosis and then there was life after, everything after, like a line down the center of your life. And not everyone remembers the date and the time. I sure do. My diagnosis date was the 23rd of July, 2018 at 5:30 p.m. For me, it's almost like a birthday. It's like a date I'm never going to forget. And when it happened, it was like a bomb going off in my brain. And I deal with this stuff all day, every day. And that didn't make a scintilla of difference. I was just as vulnerable and just as raw as anyone else in that situation. Diagnosis shock is it provokes a big anxiety spike in us. It often sets off a thing called fight and flight response. And a lot of you would have heard of that. And that's essentially when your body gets ready to either fight something or get away from something that's threatening. And the diagnosis of a cancer is particularly threatening. And I think maybe more so for a lot of blood cancers than for tumor cancers. I think that blood cancers, and again, a lot of you watching will know this well and truly, and you may really feel the difference between a blood cancer diagnosis and a tumor cancer diagnosis. Often blood cancers don't have a great reputation. The stats around them are not always good. The fear is very high. The sorts of things that are said around a diagnosis, just like Garry was saying, can be extremely anxiety provoking. So I think that probably the anxiety response in a blood cancer diagnosis is as high as it could be. And people often feel very anxious, not just in the moment, but they feel very anxious for at least the first couple of weeks while they're getting more information about exactly what it is that's going on and what the plan might be to address the cancer. Once a plan kind of starts to come into focus, the anxiety sometimes starts to settle because what we're experiencing is what we call an increase in perceptions of control. So once you've got a plan, you start to be able to feel like, okay, I can do something about this. I've got a way of being able to either combat the threat or neutralize the threat. But when all you've got is just the emergence of the threat, all you feel is just really, really scared. The sorts of things that it can set off in the moment is a thing called information control. And that's where, not for everybody, but for a lot of people in the early days after diagnosis, there can be a real focus on who knows what when and holding tight onto information. So being very clear about, letting intimate family members know, maybe holding on to information away from people until other people know. And I think what that is, it's not about necessarily privacy or secrecy. It's about just increasing perceptions of control. When everything is spiraling out of control around you, you want to hold on to anything you can that feels like you're keeping a modicum of things in your own control. And the other thing that we see in that space is in women, we see a lot of almost like what I call nesting behaviors. So it's like kind of cleaning and organizing. And in men, we often see things like they go out into the shed. And again, it's not because anybody really wants a clean bathroom when they've got a cancer diagnosis. It's because if you can control your immediate environment, you actually don't feel that things are quite as out of control as they actually perhaps are. Diagnosis shock reflects a big response to instant change. So for anyone who's been through it, it kind of like throws every part of your life up in the air. Things like work, finances, what to do with kids or aged parents, what to do with all of your commitments and responsibilities, how to move out of just everyday life and into something that you had no idea was coming and that you've got most people haven't been through a cancer experience before. You've got kind of no prep or no prior warning or knowledge about how to handle. And the other thing that it tends to do is it provokes us into like a survival mode. And the reason I highlight that is because sometimes what happens through diagnosis and treatment is there's not a lot of psychological processing. There's a lot of psychological responding. So you feel the strength of the emotions, you feel the fear, you notice the loss, but you don't process it. And what happens through diagnosis and treatment is often your psychological system is almost on hold, because the focus very reasonably, very appropriately, is on just getting through the appointments, the treatment, the side effects, the more appointments, the treatment, the side effects, and you are literally holding on like an endurance exercise. And I think that that's particularly so for blood cancers, which, as most of you would know, involves a lot of time, often in hospital, a lot of very serious side effects, which are incredibly challenging to tolerate. There is simply not much space in your brain or your psychological system to focus on anything other than just getting through it. And the reason this is important is because when treatment comes to an end, and I'll talk about this more later, but when treatment comes to an end, it's like somebody takes their finger off the pause button and you go out of survival mode, and all of that stuff that you haven't been processing because you just couldn't, it comes at you like a bit of a tidal wave. And that's when I get a lot of referrals, is when people have stopped physical treatment, stopped hospital-based treatment, and they find themselves falling into a bit of a hole because all of the stuff, all of the meaning around their diagnosis and what it means for them and their family and their future starts to really settle on them. Next topic is emotional isolation. This is one of those things that I call almost a universal experience for my clients. And emotional isolation is best summed up in the language, they just don't get it. And emotional isolation is one of those kind of weird things where often during a cancer experience, a lot of people, not everybody, but a lot of people are surrounded by people who really, really love them and are actually there for them, and they're supportive and they're acting with love and good intent, but they still don't get it. They still don't get what it's actually like to be diagnosed and going through treatment. And so if you're on a desert island and you feel emotionally isolated, it kind of makes sense because you're on a desert island. There's no one there. So of course, your brain goes, well, I would feel emotionally isolated because I am. But when you feel emotionally isolated and you're surrounded by people who you know care about you, it can feel very unnerving. It cannot make sense. And the way that emotional isolation often works is that we often feel quite disappointed or let down by our loved one's inability to get it. And so I put together this little cycle that kind of just describes what often happens. So the top right-hand part of the screen says that's the beginning of the cycle. So the way that it works is that we feel emotionally vulnerable and our brain goes looking for emotional support. So we seek emotional support from others. Now, that doesn't mean we go out with a flag or we go out saying, gee whiz, I really need some emotional support. Our brain is just on the lookout for it. We're aware that we need it. But when we fail to locate or receive emotional support, we feel hurt, we feel disappointed, we feel let down, we feel isolated. And because that says to our brain, that was dangerous, putting myself out there, making myself vulnerable, looking for emotional support and not getting it, that hurt me. What does our brain do? Our brain goes, that wasn't a good outcome. That was dangerous. That didn't work for us. I'm not going to do that again because I could get hurt all over again. So what will I do instead to protect myself? I'll withdraw. And the problem with the withdrawing is that top left-hand corner of the screen, we are left feeling even more emotionally isolated than we were. This is so, so common, and it's so hard because what it means is that, and as a therapist, I find myself discussing this a lot, is that one way to tackle it is to encourage yourself to step forward into that space and make yourself vulnerable again. But your brain's going, I don't think so. I'm not going to do that. I'm not going to put my neck out there and get it chopped off again. And this is where I really highlight the importance of finding your tribe, finding people who do get it. And my common saying for this is that empathy is gold. Go where you're understood. And this can be through things like support groups, peer-to-peer networks, connecting with people that you might have even met through the cancer experience, through being in hospital or other ways. But linking with people where you do feel like there's that sense that they get it. Empathy is one of those things that I think we don't realize its value until we need it in a situation like a cancer experience. And what empathy kind of looks like is listening, validating. And that might be hearing the words that something like, I can see how much this is affecting you. I can see how hard this is for you. I wish I could take it away. Leaving people with the feeling that the person they're talking to or relating to gets it. And the feeling that the other person isn't trying to diminish it, dismiss it, challenge, or fix it. In Western culture, we are very solution focused. We're very much about like, identify the problem, let's find a fix. I mean, if there was an easy fix for blood cancer, we would have done it already. You know, this stuff is not easily fixed. The emotional stuff that goes with it is not easily fixed. But sitting with someone, sitting in the distress with someone is an incredibly supportive, powerful thing to do. And we are not socialized around that. We are not taught that in primary school. We are very much about like, let's think about strategies. Let's think about what we can do to fix it. And sometimes when there isn't a fix, it's just so useful to sit with the person and not have them be alone in their distress. The only word of caution that I give with empathy is that the thing that's really important to remember is that everybody's experience of cancer and treatment is individual. And the risk that there sometimes is with empathy is that if you're relating to someone who's going through a similar experience or has been through a similar experience, sometimes we can start to slip into thinking that maybe their experience maps onto our experience. And in my experience, that actually never happens. Everyone's experience is a bit different. So the risk is sometimes that we think, oh, well, if that worked for them, that would work for me, or that treatment worked for them, that would work for me. Or their husband responded to them that way, so my husband will respond to me that way. That's a risky place to go. So it's always helpful to just go, okay, I can really enjoy the empathy that I get from a particular person, but I need to remember that their experience is not my experience. Relationship changes. This is one of those topics that, you know, I could talk on just as a webinar all by itself because there's so much in it. Little pick of relationships. These are the sorts of things that come up in relationships, surprises and disappointments. I think, again, a universal experience is that all of my clients at some point have described both positive surprises of feeling buoyed up and pleasantly surprised by people who've really stepped up during their cancer experience, and also disappointments where people have vanished. I call what happens after a diagnosis of cancer the flocking. And the flocking describes how often you get a real surge of social contact. You get flowers, you get casseroles, you get cards, you get phone calls, you get texts, you get visitors, and a lot of it happens pretty early days. And some of it is with absolute good intent, lots of love, lots of connecting, lots of support. But some of it's with another agenda. Sometimes there can be, you know, people wanting to be close to the action. Sometimes people want to kind of like a bit of social competition. You know, I took one casserole. Well, I took two. You know, I was there at the hospital. I was there when she found out, that sort of stuff. And what we see after the flocking is we see the vanishing. Most people quite like the flocking. Nobody likes the vanishing. And the problem with cancer treatment is it's not like a knee reconstruction, not that that's a small thing, but, you know, or a broken bone. Cancer treatment goes on for a really long time. And when the vanishing happens, you can feel that real sense of emotional isolation again. It's kind of like, oh, you know, I was interesting, I was novel, I was important, I mattered when I was diagnosed, but I'm not so interesting now. It's kind of old news. It's a bit boring. That's not a nice feeling. Sexuality and intimacy. Most people, possibly all couples who go through cancer diagnosis and treatment, notice the impact of sexuality, of it on sexuality and intimacy. I know that my husband, Rob, and I certainly did. He's a clinical psychologist as well. We talk about this stuff all the time, but it doesn't make it easy. Things change. Your body doesn't work the way that it used to. You might respond differently. You might have felt emotionally isolated and alone, and that can build up resentment and distance in relationships. The next point, dual relationships, plays into that. So dual relationships is when in a mature relationship where you might be partners or husband and wife, or wife and wife and husband, you might have been together a long time, and then overnight this other relationship starts in your house, and that's one of patient and carer. And nobody knew it was coming. Nobody signs up for being a carer overnight. You just wake up one day, and as well as being a partner, you're suddenly a carer. And as well as being the patient, you're also their partner. And that places enormous strain on relationships, because when you relate to each other as husband and wife, or partner and partner, or when you relate to each other as patient and carer, and you both got those hats on, it works okay. But when I would relate to Rob as his patient and he would talk to me as his wife, it's like you're crossing lines, and that can get really messy, and it can play into things like sexuality and intimacy, because, you know, on the same day that you might be thinking it might be quite nice to have a kiss and a cuddle, you're also looking at your partner as the person who's managing your medication or taking you to appointments or dealing with your bodily fluids. And that's really hard. The sandwich generation is another part of relationship sort of pressure. And that's the term that I use for people who often are experiencing a cancer diagnosis and treatment at the same time as they might be managing parenting children, and they might also be managing older parents. And because cancer is really, for most people, again, not all, but for most people, it's a diagnosis that comes often in middle to later age. A lot of people, when they're diagnosed, are, you know, raising families and also dealing with older parents. And so just because you get a cancer diagnosis doesn't mean that overnight your caring commitments and responsibilities just sort of get up and leave. They don't. And a lot of parents and a lot of sons and daughters don't want to abandon their responsibilities. But it's not hard to see why that might act as a really strong additional stressor, because you're trying to do your own, manage your own health and treatment, but you've also got this awareness that I've got to kind of protect and still make sure that my kids are okay, or my parents are okay, or all of them are okay. Positive pressure. So this is, again, one of those universal experiences. It's a good example that, you know, you can have too much of a good thing. A lot of people will talk to me about the distress and sometimes the anger and frustration they feel when people around them will make what I call very clumsy remarks about cancer diagnosis and treatment. Often the remarks are coming from a good place. They're often coming with good intent, but also they're coming from a place of ignorance. Not that that's anybody's fault. It's a function of the fact that they often have absolutely no idea what it's like to be in the shoes of the person going through cancer. But they will say things like the bubbles in this screen: just stay positive. You're strong, you'll be fine. Think happy thoughts. The very common one is you look great. And this is really hard, because often what happens is these sorts of interactions happen when people are emerging from treatment. Might be when they've come out of hospital, could even be when things like hair's starting to grow back. They might be, you know, out and about a little bit more than they have been for the last few months. And because when we go out for a coffee, you're not often in your pajamas. You're usually showered, you're usually dressed, you've usually brushed your hair. You're functional. You might have driven there, you've got money in your wallet, you kind of look like a functional person. And so often the response from people around you is, you know, you look great. And it's like, yeah, I mean, good, because who doesn't want to look at least sort of halfway human? But the you look great can set off that emotional isolation thing, because it can feel very much like that all of the struggle that you have been going through and are continuing to go through is invisible, and that people are not seeing the struggle on the inside. Ongoing adjustment. It's the whole thing. This is one of those things. I loved it when Garry was talking about his story, and he said, you know, one of the big things was that he needed to adjust. And adjustment is one of the reasons, or a difficulty with adjustment is one of the reasons that I get a lot of referrals, because people often want to go back to the way it was before diagnosis. They want to go back to normal. And I am often the person delivering the news to them that there is no going back. There is only going forward. We go forward to things like the new normal, the next version of you, the next chapter. This is a slide that just highlights the reason that adjustment is such a big issue, and it's one of those things that not very many people understand. So this is just what I call the timeline of a cancer experience. You start down the bottom at diagnosis, and you have hospital-based treatment that can last months to years. And at the end of hospital-based treatment, this other thing starts. And this is the bit that most people haven't heard of. Their oncologist generally doesn't mention it. Often it's someone like me who breaks this news, that there's this whole other part to a cancer experience called post-treatment adjustment. It starts at the end of hospital-based treatment, and the clanger is that it lasts at least 2 years and often a lot longer. I'm 4 years from diagnosis. I'm 3 years from treatment. I'm still adjusting. One of the things that people really struggle with in this adjustment process is the new normal. So imagine that line is your life and you get a diagnosis. Your pre-cancer life is there in that quadrant before diagnosis, and your post-cancer life or your life with cancer is that quadrant after diagnosis. Your pre-cancer life is your normal. Your post-cancer life is your new normal. One of the things that happens during this experience is that in your pre-cancer life, everybody has a bunch of expectations, standards, and behaviours that they use to get them through life. Act as motivators, get you out of bed, get you to work, make you do things, pay the bills, keep kind of functional. And what we usually do without recognising it is after diagnosis, we take those expectations, standards, and behaviours and we drag them into our post-cancer life. We hold ourselves accountable. We think I should be able to do things at the same speed, to the same standard, in the same amount of time as I used to be able to do them. And guess what? You can't. And what that sets up is feelings of failure, disappointment, and frustration. This is so, so common. It happened to me. I thought, I'll be different. I know all the tricks. Won't happen to me. It happened to me. I thought I'd be able to get right back. I went back to work too soon. I did too much, had a big psychological crash several months later, had to take 3 months off work, all because I didn't take my own advice, which is to recalibrate expectations of yourself. Recalibrate is sexy language for change. And I'll talk about a strategy to manage that a bit later. The new normal is about acceptance. Now, acceptance is not saying I am okay with the fact that I got a blood cancer diagnosis. It is not okay. It's about going, something outside my control happened, and I am aware of that, acknowledging that, and ultimately coming to accept that. It is about recalibrating expectations, and it is really hard for people who have had a life of competence. For people who are used to being really effective and being able to manage situations and make decisions and problem solve and sort stuff out, I call that the tyranny of competence. When you are used to being competent, you have very high expectations of yourself, and other people around you have been educated to have very high expectations of you. So often you think, yep, just going to bounce right back. Just going to bounce right back to that life, get back on that horse, do all of that cool stuff, manage the kids, manage my parents, manage my job, manage my life. And your partners, your children, your parents, your colleagues may all have the same expectations. There's often a real enthusiasm in our support network for us to get back to normal. And so the pressure doesn't just come from within us, but it can come, again, not with malintent, but it can come from people around us. Bunch of common psychological responses. First thing is this thing called the snow globe effect. And this is like what I call a perspective change. So imagine that your life, and normally I would have a little snow globe here, but the snow globe is one of those things you see at a tourist store when you're traveling. So like a little tiny one with Ayers Rock in it or something like that. That's probably very, very non-PC. Maybe I should have said the Eiffel Tower. But the snow globe is your life. A cancer diagnosis shakes up your life. All of the little snowflakes are your values and priorities. And when they settle, none of them settle exactly where they used to. So things that used to matter before don't matter anymore. And things that didn't matter before maybe matter now. And I think, again, Garry referenced some of that he thought about how he might like to do his life differently. It's kind of a cool thing. I don't think there's much that's good about cancer, but this is one of those ones that can be good. It's not always good, but it can be good because it can give you the chance to kind of think about a do-over or a reset. Like, if I've got a second chance at this, do I want to do it the way I was doing it before? It gives you increased clarity and an increased willingness to prioritize your own needs, to do what matters for you. Other psychological responses are strong negative emotions: shock, fear, anger, sadness, guilt. I'm just pausing there because I've miserably failed to monitor my time. How am I going for time? Okay or not okay? Okay.
You've got about 15 minutes, Charlotte.
Okay,
All good.
cool. No worries. So I'm just going to run through some of those in a bit more detail. When we feel strong negative emotions, when we feel strong emotions generally, what sits behind the emotions are thoughts. And again, because we're not socialized, we're not taught about this in primary school, possibly even in secondary school, possibly not ever, unless you go in to see a therapist. We're not taught to identify our thoughts, but the thoughts that sit behind things like fear are, what if my treatment stops working? What if the cancer comes back? What if I die? They're big, fat thoughts. They generate big, fat emotions. Anger thoughts. It's not fair. A real sense of injustice. Again, very, very common. A lot of people feel like I've lived a healthy life. I didn't do anything wrong. I followed the rules. I ate okay. I did the exercise. I managed my stress. How did this happen? There are good people there are bad people out there not getting cancer. How come like I got it? Why me? One of my referring oncologists, he's a lovely man, and he often says to his patients when they say, like, why me? He looks at them and he says, why not you? Because he recognizes that apart from genetics, a lot of cancer diagnoses are basically random chance, kind of like the opposite of winning lotto. That real sense of I did everything right. And back to emotional isolation, other people don't understand. They just don't get it. Lovely angry picture. Sadness thoughts. I've lost so much. Again, back to Garry's comments about loss. And people with cancer diagnosis and treatment often face loss almost overnight. Things like work, financial stuff, relationship stuff, access to the hobbies and interests, behaviours, joyful, pleasurable activities that maybe we engaged in and maybe we even on some level took for granted. That awareness that my life is not the same and it's not ever going to be the same. And that sense of what I call anticipatory loss, which might be that I may not live to experience important events, to be there for my children growing up at those milestone events, to not have the future that I imagined with my partner. Big, big, big sad thoughts. Guilt thoughts, so common. In Western culture, we do guilt really, really well. So there can be a real sense of our own cancer diagnosis being a burden and being a stressor for the people around us, and that somehow we're responsible because it's our cancer. It's like, you know, I'm the one who's brought this on our family. I'm the one who's brought the stress into our life and the risk and the fear going forward. Even if there is actually no evidence to support that, as humans, we seem very, very capable of taking on guilt. That sense of I'm a burden, you know, that real sense of having to overnight become dependent on people around you, needing people to help you get to medical appointments, make medical appointments, attend medical appointments with you, support you through treatment and side effects. Even things like, and I was thinking about this particularly when Garry was talking about how in blood cancer, treatment can often involve other family members. And whilst when that works out well, that can be just such an amazing contribution and experience for the people involved, it can also set up some really tricky things in relationships. It complicates things. It's another factor that we don't see really in tumour cancer. And some strategies. So these are just 5 short strategies. The first one is about emotional isolation. And this is about awareness. It's about really tapping into noticing if you are pulling away from others because you have that sense that they don't get it. And then instead of allowing that cycle to just perpetuate, as I highlighted before, where you end up actually feeling even more isolated than you were in the beginning, is not to put yourself back out there and make yourself vulnerable with the same people who let you down necessarily, but to actually look more with more awareness at finding your tribe, about finding people with whom you can connect. Now, it might not need to be many. I have a client at the moment who has advanced ovarian cancer, and she's met 2 women during her chemotherapy experience, and the 3 of them have formed a little group, and they are such amazing supports for one another. And they only catch up about every 2 or 3 weeks, but the comments that she's making are that there's a shorthand to those discussions. There's an understanding. They don't sit there and talk about cancer the whole time. They don't need to, because they don't need to educate or persuade or fill the other person in, because they already know what they're going through. So that idea of actually finding people with whom you do feel they get it is really powerful. The hard thing is, and this is the bit that often people feel quite angry about, is that it means that on top of everything they're going through, managing treatment, managing side effects, managing their emotional stuff, they have to then be the one to go out and find their tribe. It's like, really, do I need to have that extra stress? Unfortunately, the reality is that usually the tribe doesn't come knocking. Number 2, fear of recurrence. Again, a subject that I could talk on for a whole webinar. There are 6 main triggers for fear of recurrence. So very quickly, they are diagnosis, medical reviews, media stories, physical symptoms, anniversaries, and the death or diagnosis of a friend or a family member. So you can see that just with those 6 triggers, you're going to have fear of recurrence triggers pretty frequently. The most significant trigger for most people is physical symptoms. So if you get a physical symptom, and if you get a physical symptom that is similar to something that you might have noticed before diagnosis, it sets off a big fear response. A lot of times people will be talking to me about, wanting to speak to their medical professional about a scan or a blood or a review so that they can get the reassurance that what's going on with them isn't anything sinister. And the thing that we notice in those situations is that often they have interpreted the physical symptom in only one way, and that is that it's a recurrence, that it's the cancer, that it's back. I'm good at it too. I can get a headache, and in a nanosecond, I can be absolutely convinced that I've got brain mets. What I've learned, though, is that if I challenge myself to identify 2 alternative explanations for the same physical symptom, what it does is it spreads the fear. So I don't say it's not brain meds. I don't do that, because that's invalidating that. And truthfully, it could be. But instead of putting all of my fear eggs in one basket, I actually challenge myself to find 2 alternative explanations. So in this case, if it's a headache, I'm routinely dehydrated. I never drink enough water. So probably one of them would be that I'm dehydrated. And the second one's probably that I haven't had enough sleep, because one of my post-cancer experiences is that I have an insomnia. And so I'm usually pretty tired. So they're my 3 explanations for the headache. And what that does, if you like, if you've got 100 fear eggs, it spreads the 100 fear eggs across 3 baskets rather than them all going in just the one basket, which is it's a recurrence. It's one of those strategies that with practice, it comes more easily. And it's never to invalidate the first interpretation, but it is just a way of taking the heat out of that first explanation being the only one. Number 3, change of perspective. So this is back to the snow globe effect that I was describing earlier, which is that idea that your life's been shaken up by cancer and that it changes your perspective, and what matters and doesn't matter to you becomes clearer, and you're happier to maybe make changes to live a life that's more consistent with that increased clarity. But the thing that often causes people to come unstuck in relation to the snow globe effect is when the changes that they've identified they want to make don't fit with their existing life, and when the people around them don't have any idea that's going on, because usually it's going on up in your brain and it's often not kind of coming out of your mouth. But if you're able to identify and say, do you know what? I don't know if I want to work full time anymore. I don't know if I want to live in an apartment anymore. I don't know if I want to keep being the leader of the Scouts. Maybe I want to make a change. Maybe I want to prioritize me, make more time for me, live somewhere else, do something else. But if you don't tell anybody else, it can be really puzzling for them, because it kind of looks like you've changed, but they don't understand why and they don't understand how. And if it doesn't fit with your existing life structure, it can be really stressful, because it can kind of be like, hang on a second, we've spent all of this life together. We've made all these big decisions. We've bought this house, or we've moved here, or we've taken that job. And now what? You seem like you're not happy, or you don't want to do that anymore, but you're not talking to me about it. I don't understand it. So identifying your perspective shift and communicating it to the people around you can be really helpful in cluing them into where your mind is at. Doesn't mean it's all going to make it possible, but at least it reduces the chances of miscommunications and misunderstandings about why you are the way you are. Number 4, post-treatment adjustment. This is that thing I mentioned before about recalibrating, which is just sexy language for changing your expectations. So I like maths. Maths is cool because maths is something that we can all do. So it's about using maths to adjust your expectations of how long, how often, or how well you will complete a task. So if, for example, it used to take you, say, an hour to do something before. So let's say it might have taken you an hour to clean a bathroom. You add on a third to a half. So you add on 20 minutes to half an hour to that, and it's going to take you now an hour and 20 or an hour and 30 minutes to do that same task. If you used to be able to stand on the soccer pitch and watch your kids play soccer for an hour at a time, you have to divide it by a half. So you can only then expect that you can do that for 30 minutes before you need to have a rest. If you used to do something to a particular standard, so this is a really naff example, but sadly it's the truth. I used to, the house that we used to live in had a lot of glass windows, and very occasionally I would clean the glass windows. And I'm a perfectionist, not so much anymore, but I'm a perfectionist. And so I used to clean those suckers until that glass was completely clean. No dribbles, no bits of hair, dog hair. You know, they were shining. Now, if I were to clean those windows, I do it to about 75, 80%. I get to a point where it's like I stand back and it's like, yeah, they're better than they were. Bit of a streak there, bit of a dog hair there, but like they're better than they were. I'm okay with that. Now that sounds kind of lame, but actually dropping my standard from kind of 100% to 75 or 80% is a really significant change. And being able to do that sort of thing in different parts of your life, it does make room for the changes that your body has gone through. The thing about cancer treatment is that at a cellular level, you are different. Got that? At a cellular level, you are different. It is going to take months or years to rebuild your body. And when it is rebuilt, there will be things that are never, ever the same. Fatigue levels, cognitive stuff, emotional stuff, different, not ever going to be going back, not necessarily worse, just different. Number 5, the silver bullet. Sometimes my clients are a bit puzzled because they come in and they're like, why are we talking about exercise, Charlotte? You're a psychologist. Like, aren't we meant to be talking about thoughts and feelings? I talk about exercise as a silver bullet or nature's antidepressant. Yeah. I find exercise annoying because it works. If it didn't work, I wouldn't have to do it. It helps everything, like actually everything. Helps sleep, helps mood, helps fear of recurrence, helps body image, helps sexuality and intimacy. And the other thing that's good about it is for a lot of types of exercise, not all, but for a lot of types of exercise, it can be relatively cheap or free. It's relatively safe. You can do it with other people. You can do it by yourself. You can do it while you're doing other things like listen to music or a podcast, talk to somebody. So it's a very easily applied strategy that has so many benefits. I talk about walking as a superpower. I was talking at a conference years ago, and there was a wonderful professor talking. His name was Professor Mitra, and I won't stand up and do the dance because I'm not wearing a lot of clothes on the bottom here. But he walked across the stage like John Cleese. He said, I just say this to my patients when they say, well, what should I do? He says, just do this. And he walked across the stage like a bit of a funny man. And he said, walking is a superpower. And it is. I walk on a treadmill usually because we live in the Adelaide Hills and it's freezing. But I walk on the treadmill 15 minutes in the morning, and when I can, 15 minutes in the evening. It's not a lot, but when I don't do it, I really notice it. 5 minutes with the Spice Girls. I bought 2 hand weights. They're about 1.5 kilos each. My taste in music is somewhat questionable, but I stand in front of the mirror and I do my little pumping iron routine with the hand weights. And what I noticed when I did that was, and I didn't understand this at the beginning, I didn't understand why it was so helpful. And what I think it was that, and I now know this is partly why they put mirrors in gyms, is that when I was using the little hand weights, because I was just wearing like a singlet and a pair of bike shorts, I was actually watching my muscles flex in my arms. I don't have big muscles, but I could see the muscles working. And the message that was sending my brain was, I am able. I can do things. I am getting fitter and stronger. This is about what my body can do. Really powerful messages from something actually really quite small and simple. Smug swimming is my last bit. We're lucky enough to have a pool. I've got a long-standing history as a swimmer. That's the sport I did when I was growing up. And swimming's one of those things that uses every single part of your body, and it's pretty good to do because it's very hard to injure yourself when you're swimming. But swimming in the Adelaide Hills when the water is cold, which is all the time, is not all that enticing. And I stand outside and I have to talk myself into that water. And when I do it, I get out, and my husband, who's usually not always in the pool with me, will say, how do you feel? And I say, smug, because it's usually been quite a thing to get myself in there. But boy, when I do it, I feel really good. I feel warm, I feel strong, and I feel a bit proud. That's my weights. Last slide. Support, go where you're understood. Empathetic others, like I said before, finding your tribe. GP, if you've got a good GP, and not everybody does, but if you've got a good GP, they're a very good place to start if you need somebody that you can trust and debrief with. And a therapist, people like me. We are not hard. We are not easy to get into. I wish there were more. If I could clone myself, I would. The mental health system in Australia was full before COVID, and it is overflowing now. People have wait lists, but that doesn't mean you can't get on. I have a wait list, and I am often able to contact people and say, I can bring your appointment forward, or would you like to grab this cancellation spot? The way you get in to see someone like me is you can self-refer, as in you can just make contact yourself. You can go via your GP and get a referral and a thing called a mental health care plan, which means that you get access to the Medicare rebate. You can't get the Medicare rebate for psychology unless you have a mental health care plan. And there are some limits to the number of sessions per year, but it makes it more of an economical option, because the truth is that seeing a clinical psychologist isn't a cheap option. But it's not the sort of thing you have to do forever. A lot of my clients will see me for a while, or they'll see me for a few sessions close together at the beginning, and then we spread the sessions out over time. So it doesn't have to be as financially harsh as you might think. There are other counselling services through things like Leukaemia Foundation, and I think touching base with someone is always a good starting point, because that someone can often help you figure out whether you need more support than what they're able to give, or whether just something that you're getting at that point is sufficient.
Thanks so much, Charlotte. There have been so many comments in the chat, and I'm just going to make one comment before we move to the Q&A, and it's the amount of validation people have felt in hearing what you've spoken about, feeling like this space right now is their tribe. That there's such a sense of relatedness. So incredibly powerful. I'm actually just blown away by the comments. So thank you so much. I'm going to hand over to Jen now to kick off the Q&A and invite both Charlotte and Garry into that conversation.
Oh, wow. I agree. I've been reading the comments and it's blowing my mind that Garry's story and Charlotte's experiences professionally and personally have really touched everybody in a very personal way. And I think that leads really beautifully into a lot of the questions that were submitted in advance. And I think that idea that blood cancer affects us both physically and emotionally, and, you know, often our mental capacity to continue doing the things we used to do, our work and even in our families, can be really significantly altered. And so there's a deep sense of personal loss. There might be a loss of self-worth, a loss of self-identity. I think, Garry, you talked even about your loss of your job. You know, you were born to be under the sun and the stars, and it was really even hard just being in hospital. So I wanted to ask you both, and I'll start with Garry. How did you start to, I guess, redefine yourself or rebuild that sense of worth and turn things around from what you couldn't do to what you could do in your life and what you could contribute?
Well, it took quite a while. My journey through hospitals, especially the end, before the transplant, where I had to be in isolation for 30 days, gave me a lot of time to think about everything. Think about my life before and how I did things and how it was going to be different. And so when I came home from hospital, I went to the Leukaemia Foundation first, and then when I finally came home, all that thinking I did, I made promises to myself that I would change things. And that's exactly what I did. And it took a long time to do it because I kept thinking about my old way of life and how I loved that way of life. That's all I ever did. I was born into a family of cultural fishing. And so that was gone now. So I had to, big thing for me was exercise. It was massive for me. And being a Torres Strait, Aboriginal Torres Strait Islander man, going walkabout all the time. Like I would walk for miles and miles every day and think about things and how I can change things. What's the best for me? What's the best for my family? And what sat good with me. It had to sit good with me, otherwise it was never going to work.
Yeah.
And so that's pretty much coming from that holistic way of living as well, and practicing certain things that I used to see the elders practice. In holistic healing, it all went towards helping me figure out who I was going to be, because I was, you know, like what Charlotte said, like it was a line. It was like my life went like that, and then bang, that's that line. Now here's this new life that I have to organise. You know, have to think about and get under control. So yeah, once I found that this was going to be me, the new me. It all sort of started to roll. It just rolled. It just got bigger and bigger and bigger to where I am now. So, yeah.
Thank you. It sounds like that period of reflection and walking and seeking advice from elders and taking the time to think about your values and how you were going to live that out was really quite central to that process for you.
Yeah, very much so, yeah.
Yeah. Charlotte, would you like to comment on that?
Yeah, I think Garry's reflecting ultimately is that adjustment process and getting to that acceptance kind of place. And I love the fact that walking was such a big part of that. It is for me too. It was for me too. When I took my time off and I went away for a month, and at the beginning I was so sleep deprived. All I could do was walk and try and sleep. And it was the walking, but it was the walking and the thinking. And then I started to write about what I'd been thinking, and that's actually informed a lot of the work that I do. So I love what Garry was saying. There are 3 stages to adjustment. The first is resistance, the second is acknowledgement, and the third is the acceptance part. And a lot of people who find themselves in the therapy room with me are stuck in the resistance part for a while. And part of what the therapy does is it gets them to that acknowledgement kind of stage. And then often the acknowledgement move to acceptance comes a bit easier, because it's once you let go of the resistance and you let go of that idea of like, I'm going to go back to my old life. Once you let go of that and sort of go, okay, there is no going back. I've got to find my way forward. That's the big shift. And when that happens, you start to then be able to go, I'm not able to do the things I used to, and I'm not going to hold on to that and have that frustration that comes with it. Once I let go of it and go, do you know what? There's some stuff I just can't do anymore. I used to work 5 days a week. I don't work 5 days a week anymore. I consult 4 days a week. That's a 20% drop. That's a big deal in my world. But I can then do really good work on the 4 days, but I couldn't if I was doing 5 days. So getting to be okay with that. And I am totally okay with that. I was not okay with that at the beginning. I was like, no, I'm going to keep doing it the way that I used to.
Sounds like sometimes we're our own worst enemies, and it's that real clash of expectation and trying to recreate what was there when, as Garry said, there's a line in the sand and it's before and after. And the only way you can live is forward, and you have to somehow shift gears to do that.
And the thing about the pre-cancer life is it's the familiar. It's the known. We know it. Even if it wasn't all good, it's like we knew how to do it. We knew how to run it. We knew how to navigate it. So that idea of having to go forward into something that we don't know quite what it looks like, that can feel very unfamiliar and therefore quite scary.
Yeah. Speaking of scary, quite a few of the questions related to this idea that there can be a constant and a bit of a pervasive sense of uncertainty or fear around some aspects of blood cancer. So, for example, people that are on watch and wait, or for some people being in remission, just means they can never drop that fear of recurrence sitting quite strongly on their shoulder. So I'm going to go to Charlotte first on this one. How do you suggest people manage this so they can live their lives around the uncertainty rather than the uncertainty taking over their life?
Absolutely. So fear of recurrence is probably the most common specific anxiety experience for people after cancer diagnosis. And it's really normal. It's really hideous, but it's really normal. The stats tell us that 70, but even up to 90%, and I frankly think it's everyone who has had a cancer diagnosis and treatment experiences some fear of recurrence. There are different levels of recurrence. It sort of ranges from mild to severe. It doesn't go away. It's one of those things, I call it like, you get a diagnosis and you get fear of recurrence. It's like a gift with purchase and you don't get to give it back. And it's with you forever, like an uninvited companion on your journey in life. And in my world, I'm kind of like, let's lean into it. Let's get to know it. Let's understand what your triggers are. Let's develop your awareness around it, give it a name. So the other thing that I do, and this sounds quite odd, but it is quite effective, is I use this strategy called objectifying the fear. So if you've figured out that you have fear of recurrence, as in you're noticing that you're thinking and feeling about what if the cancer comes back, is that symptom a sign of recurrence, wanting another scan sooner because you're so fearful, feeling like you're kind of aware of that fear of recurrence. What I get people to do is I get them to objectify the fear, which is to turn it into a thing. So the questions I ask them are, how big is it? What color is it? What size, what shape is it? Is it a uniform shape, or is it something not uniform? Has it got a texture? Can you move it? Can you see through it? And so what this does is it turns it into something that you can actually, in your mind's eye, you can see. So my fear of recurrence is, I haven't got a picture of it today, but for anyone who watched Game of Thrones, it's an iron fist, a bit like Jaime's hand, fake hand, his prosthesis hand. It's a metal fist. It's very solid, dense, quite small, very powerful. And what it does when I can see my fist, my fear of recurrence, is I can set it aside. I can put it in my mind. I can set it aside. I can get on with my day, knowing it will always be there, and I can come back and relate to it when I want to. And so by turning it into an object, we're able to get a different perspective. We're able to set it aside, get some distance from it. And it gives us a little bit more of a feeling of being able to control or manage the fear of recurrence a bit more, rather than it feeling almost like a wet blanket over you all of the time.
Yeah. Thank you. Garry, I don't know if you would like to add something to that about how, or if you even have that sort of quiet fear in the background, or whether you've managed to ditch it, what sort of suggestions you would make, or or talk about how you've managed that.
I've I don't know. I guess I've been lucky enough or gifted to not have that fear.
Yeah.
In my mind, I've go back to that 30 days in isolation. I did a lot of thinking, and I made a promise that after this transplant, if it all went well, and I knew it would, that I would always help people. And so I don't have time to get sick again. I'm just busy all the time. And it doesn't, I just don't let it enter my mind. And I am aware of the signs when I first started to become unwell.
Yep.
And it's been 22 years now since the transplant. And I've just kept myself so busy. And people say to me, how often do you go back for checkups? And I said, well, I don't. I just don't go back for checkups. I said, I have some blood tests sometimes if I'm not feeling great. They always come back great. But I just push that thought out of my mind the best I can, and just keep myself really busy with, and everything I do is positive stuff. You know, I've managed to train, you know, I can, this might sound a bit weird, but I sort of trained myself, like I could sense when a negative thought was coming in my head, and I would just go, nah, get out. I don't need you in here. I don't want you in here. There's no negativity in my head. This is what I say to myself. And it's worked perfectly for me. You know?
That's fantastic. I love what you said about picking up on the symptoms. You remember what the symptoms were, and you just go to the doctor and you get a blood test. And I think, you know, the practical, as Charlotte was saying before, you put the practical out of your mind. You know, it's not that. And what are the other eggs in the basket, and what could it be? And for you, it's about living a positive life, being able to manage any negative thoughts if they creep in, flicking them back out, and just getting on with your day. Yeah, thank you. It's interesting. Some of this talk about expectations also has come up a lot in our Q&A, and it's a bit about one of the questions was, how do I manage or balance mine and others' expectations? And this is around hope. It's around quality of life, and particularly when people's length of survival is unknown, there's this sense that sometimes people just stop because they're waiting for the next shoe to drop. The next disaster, versus do we just get on with things and trying to sort of move forward, but almost with your brakes on in a way. And there's quite a few people that have commented on that sense of feeling a little bit stuck or a little bit unsure of how to plan or what to do. Garry, I might start with you and go to Charlotte on this one, if that's all right. Garry, have you got any comments to make around that? How you manage hope and quality of life?
I sort of, for 6 months, it was very hard for me to accept that life I had was gone. And people would come around and friends, and they would say, you can't do this. You know, I couldn't even leave the house. And they were saying, you can't do this to yourself. You can't do this to yourself. And, you know, we spoke about, Charlotte spoke about before, about people don't get it. They just don't get it. You've got your family around you. You've beaten leukemia. You know, like, what's the problem? Well, the problem is that I have to restructure now. How do I do this? You know, like that's my problem. And so I had to do that on my own. You can't really get that advice for anybody except yourself, because you're the one that's got to restructure. And to move forward, you know, I sort of had this, I've got this, it's still in my head today. I'm here for a reason. You know, when I met so many people going through my journey, and a lot of the people fought so hard, but they just didn't get to the other side. But I did. So what am I here for? I'm here for a reason. You know, I'm here to help people. And there was many a time, it took me 9 years before I actually found where I was supposed to be. And before that time, I would just keep myself, like, I would volunteer to help people. I would do all sorts of stuff. There was times I'd stand out on my balcony and sing out, give me a sign. You know, why am I here? I need to find this reason. And yeah, it's a long journey, but you know, like if we can stay focused on you know how our next what our journey is going to be, and it's a good journey. You know, we've just got to somehow we've got to accept what happened, and we've got to put that to the back, and we've got to move forward.
Thank you. Charlotte, do you want to comment on that at all?
Yeah, I think that one of the things that happens through diagnosis and treatment is life becomes very cancer-centric. You know, like we are completely absorbed with treatment and side effects and tests and reviews and appointments. And there's lots of messages coming at us about what this means for our life. And it's very hard to think about feeling safe or about doing the things that we want to do. It's all about that survival kind of mode. When you get to the end of hospital-based treatment and you start to, you know, give consideration to reclaiming some of your life, it's hard because you've been in this cancer-centric mode and you're often quite fearful about, you know, what if this happens again? What if the cancer comes back? And all of that recent experience of treatment is often sitting right there in the forefront of your mind because it's very raw and very recent. And it can be quite hard to switch your focus out of that kind of mindset and more onto what Garry was describing, which is what I call purpose and meaning. And that is about figuring out what it is that speaks to you in terms of like what floats your boat, what works for you. And the tricky thing about this is it's different for everyone. So what is going to work for Garry isn't necessarily going to work for me or for somebody else. And it is about taking time, and often it does take some time to figure out what is it that's the thing that gets you out of bed. Now, hope is one thing that gets you out of bed, and we all have to hold on to hope, because without hope, there's kind of literally no point in getting out of bed. But having the awareness that without kind of some purpose and meaning, there really is no sort of point to life, and then being motivated to start to think and maybe start to talk and to research, you know, what might I want to do? What did I like to do when I was a teenager? What are my interests? What are the things that make me feel really passionate? You know, do I want to do something that involves giving back? Do I want to do something completely different? Do I actually want to do what I was doing before, but maybe just do it a bit differently so it works better for me? The thing that I notice a lot is that particularly in those early stages after the end of hospital-based treatment, when people don't really know what comes next, is it can feel like, for a variety of reasons, as Garry was highlighting, that, you know, maybe if I just stay inside, away from things, don't do much, that I'll be safe and I'll be away from people who might not get it, and I won't have to go out there and figure out what the next chapter of my life looks like. But it does leave you without much purpose, without much social contact, without the feeling of life moving forward. It leaves you kind of stuck. And it can mean that the life that you have fought really hard to save with all of that horrific treatment is now kind of not getting the benefit of being spent on things that are the things that really matter to you.
Thank you. Actually, that links in really beautifully to the next question, which is, there's been a few people commenting on what happens when you're sort of in a watch and wait phase. So you're sort of on hold for a very long time, or people are telling you you haven't got a real blood cancer, or you haven't got a real cancer, because blood cancer you can't kind of see, or you can't cut it out like you do with other things, and it leaves people in a very strange state. So how do you deal with the mixed feelings around that? There's just so many things, I don't quite know where to start, but around the whole mixed experience of the feelings and the sense of guilt or the loss of joy and pleasure that changes when things are a bit less clear.
Who would you like to talk first?
Oh, sorry, Charlotte, that's for you. I'm formulating the question in my head. Not being a bit
fine. I just didn't want to jump in over Garry.
Sorry, guys.
So that's a really hard space to live in. And I think that one of the biggest parts of it is that not only is the condition that you're dealing with, the watch and wait, the possibility of blood cancer invisible, that's a really big part of it, because humans take in information through their eyes. Okay, so if a human being is confronted with information coming in through their ears or information coming in through their eyes, they will always go with what they see, because we call it an adaptive thing. It keeps you safe. Yeah. So taking what's going in through their eyes. So somebody's in front of them kind of looking the way they kind of always have, or even the way that they did at maybe the end of hospital-based treatment or something like that, then the message to the brain is, not much to see here. They're okay. And that's really, really emotionally invalidating and isolating for the person who is going through that experience. Watch and wait is like, I think, and I don't live in that space, but I think it's, it's like being sort of suspended. It's like you're in suspended animation. Yeah. You can't really trust in the future. You can't really trust in making plans and doing things of substance. It gets in the way of being able to live what I call your authentic life, because even kind of like, really emotionally investing in stuff can feel very scary, because it's like, well, what if I take this big leap? What if I invest emotionally or even more, practically, financially in something that I want to do, and then it all gets ripped out from underneath me? So it can feel like I have to just sort of like tread water. And treading water, think about the analogy. Treading water, what happens when you tread water for a while? You get really tired.
You get exhausted.
Yeah. And if you look like you're treading water, what happens? People leave you there to tread water, because you're not actually drowning. You still kind of look like you're treading water. So it's a very, very hard place to be. The thing that I say to people, and a lot of this will feel, pretty thin, and I acknowledge that. One thing is to, again, notice it. Like, awareness is key. In psychology, that's the first thing we go for, is develop your awareness. So if you are noticing that you are feeling like you're living in that kind of watch and wait, limbo, suspended animation kind of state, is you want to put some language around it. You want to talk about it, and talk about it like that. I am living in suspended animation. This watch and wait thing is grueling. It is hard. You might not be able to see it, but it's real. Talk to people about it. And the second thing is, and this is, a bit thin, is to identify short-term goals that are big enough to be meaningful, that matter to you, but small enough that you can see the end of them when they begin. So it might be something that lasts for 3 months. I'm going to do a particular project around the house, or I'm going to do a particular project at work, or I'm going to learn something new, or I'm going to teach someone something, but I'm going to set it up so that I can see the end of it when I start, which makes it feel achievable. And truthfully, it probably does make it actually more achievable. And then you have that sense of increased perceptions of control and moving forward, not just staying stuck in that suspended animation state.
Oh, that's fantastic. I think that's such a common experience. I don't know, Garry, if that's anything you can relate to or you wish to comment on at this stage.
Yeah, well, I the short-term goals is pretty much what I did. I didn't even realize I was doing that, but
yeah,
I would just go out there and do something that really made my heart feel good, and I was actually helping the community.
Yeah.
One of the things that really helped me was, like, for a long time, I've got these fantastic memories, like from when I was a child right up to when I was diagnosed. They're fantastic memories, but when I think about them, they make me really sad. So sad. And I think it was because those days were gone.
Yeah.
And so one day I started to just write these memories down. Once I started to write them, it was like someone turned a tap on. They just flowed out of me. And then, and they're only short. And when I would read these memories, they would make me smile. They would make me laugh. They weren't sad memories. They were good memories. But I had to put them down so I could see them and read them. And that really helped me move forward when I did that.
What a beautiful idea. And I love that idea of sharing your stories, and it's almost paying it forward in a way, because if they're written down, I'm imagining you can share them with grandchildren and family and lots of other people as well.
Yeah.
There are so many questions, and I'm just looking at the time and thinking, my goodness. Linda, I think, have we got time for one more question, do you think?
We can do a couple more if people are
Okay.
happy to just stay on for a few more minutes.
All right, sounds good. I think one of the ones that's come through that I really do want to ask is, how do you cope as a single person going through treatment? You know, we've got a lot of people that live on their own, perhaps at a distance from family, or particularly with COVID, haven't been able to see family. How do you suggest people manage these sorts of big fat emotions that you've been talking about, Charlotte, when they're on their own? And I'll start with you, Charlotte.
Yeah, this is a particularly tough one, because I think it's one of those situations that, living a single life can be incredibly rewarding, great independence, great flexibility. You can do exactly what you want when you want. My sister's a singleton, and, she lives a pretty awesome life a lot of the time. But when health comes into the play, into the mix, it can be incredibly challenging. A good example of when things are going well, the model of your life can be great, but when things change, sometimes the model and the change don't really fit very well together. The thing about being a single person is, and again, if it's a single person listening, they might kind of roll their eyes or grimace when I say this, is that you kind of got to build a team. You've got to build a team, and you've got to do it fast and early. So you've got to be proactive rather than reactive. If you wait for things to get harder, which after diagnosis, kind of they do for a while, they get harder before they get better. You're often in a kind of a reactive situation. So the sorts of things that I mean by building your team is, obviously you're going to have your oncology team, your hematologist, that sort of thing, but you need other people in that team. And it might be some other medical professionals. So it might be things like a therapist, a good GP, maybe someone to help you with exercise or nutrition. But it's also about identifying key people in your social network. And it's about being really quite discerning and quite selective about that. And the other thing, and this is sometimes hard depending on personality characteristics and history with relationships, is that there is a real benefit in being very, very explicit and very clear about what it is you are asking of people. So that if you what you don't want is a team made up of people who don't know they're in a team, or who have committed to being in your team but don't really understand what that means, or aren't able to give you what you want, because that can set up that whole emotional isolation thing. But I think the first key, as with all of this stuff, is awareness, is to really kind of know, okay, well, what does this mean for me? Not just what does this mean for me, full stop. What does this mean for me as a single person? How am I going to navigate this and get ahead of the curve? Because if you wait and hope that it's kind of going to look after itself, or it's kind of going to be okay, the risk is that you are then playing catch up when things have got harder. And trying to build a team under stress is so much harder than doing it at the beginning. And the other thing is that if you do it at the beginning, during, if you like that flocking stage, you've got all the people in front of you. You've got the people that you can kind of go, okay, not her, not them, maybe have a chat with them. And then you've got the option to actually get it sort of sorted from the front end. Now that's great for people who might be watching who are at the front end. For the people who aren't at the front end, the alternative may be only to play catch up and to be building your team kind of retrospectively, which is better than not building a team at all.
Yeah.
Mm.
Yeah. Garry, any quick comment on that?
As the 7 years I worked as an Aboriginal and Torres Strait Islander drug and alcohol caseworker, it was just like really strange. I had like 4 men referred to me from hospitals that had blood cancer, and they lived on their own. They had no support. So I worked with these men, and what I could suggest is, like, if you're on your own, there are services out there that can help. For me, I've been lucky enough to have a knack of connecting pretty quickly with somebody. Now, these were Aboriginal and Torres Strait Islander people, so they wouldn't connect with. There's this mistrust, so I could connect with them and I could get things done being with them. So it's, to be on your own, like they were on their own, And so when I went and seen them and I made this connection, we could walk together, we could move forward together. So there are things out there that if you're on your own, you can look around, you can reach out, and there are those people out there that you can connect with that will really give you so much support through the journey.
That's a beautiful thing. And you're reminding me that, when we talk about our team and our community and our tribe, it's not just your hospital treating team, is it? It might be your Aboriginal Health liaison officer. It might be the pastor at your local church. It might be the person at the fruit and veggie shop where you've been shopping for 20 years who knows you well enough to organise food delivery. So I think we need to think bigger, don't we, about our team. I think our final question, I'm going to sneak one in. I'll start with Charlotte. A blood cancer diagnosis is obviously not something people ever want, and it comes at all different ages and stages of life. Charlotte, can you talk briefly about what perhaps the different challenges a diagnosis of blood cancer might have at perhaps different ages and stages in life?
Yep, for sure. Couple of things. So these comments are fairly general, and so if people are listening and they think, oh, that's not applying to me, this is kind of general, and it is reflected in the research data. Fear of recurrence is often higher in younger people. I think that part of that is because, again, with absolute regard for younger people, a lot of them haven't had as much life experience, and so perhaps they haven't been booted around by life as much as older people have. I think older people, it's not so much resilience as it's just kind of an awareness that, like, pardon my French, shit happens. Whereas I think with younger people, there can be a sense of like, this might be the very first very bad thing that's ever happened to them, and it can feel very, very scary. The other thing about being a younger person is objectively, and again, this is harsh, but objectively, they may have more years of life to lose. And so there can be that sense of like, if I lose my life, I'm just not losing my life, but I'm losing my future. And my future might be longer than, say, if I'm 35, it is very different to being kind of 85. So fear of recurrence is often much higher. For people who are younger, they might not be dealing with things like children and families, but they might be dealing with fear around what their diagnosis and treatment might mean for the future of relationships. What happens when I meet somebody who I might want to spend a good portion of my life with? Do I tell them? How will they react to this news? Are they going to kind of dump me because they feel like I'm not a good long-term option? That sort of thing. If there have been, changes to my body, weight changes, appearance changes, even things like, what I'm able to do. If I'm not as mobile or as active or don't have the stamina that I used to, are they going to kind of like reject me? So there can be a lot of that stuff going on for younger people. For people who are dealing with kids, there's a very strong sense of protection in parents, often a real sense of like, whatever I've got going on with my diagnosis and treatment, I want to try and keep things as normal as possible for the children, which is a really lovely sentiment and very normal, very, very much, that protective instinct as a parent would have. It can act as another stressor. Trying to keep things normal is, on top of everything else, can be very, very hard. And for people who are, like I described before, who are in that kind of like more middle age kind of bracket, they're often dealing with like maybe children, adolescents, and that comes with its own challenges, as well as maybe aging parents, and those commitments and obligations and stressors don't just get up and walk out when you get a diagnosis and treatment. So sometimes it's about either having to continue to manage those things or to find other ways for those things to be managed, and to manage things like the guilt or the distress that goes with how do I keep all of those balls in the air.
Thank you. Garry, is there anything you'd like to add from your perspective, either cultural or otherwise?
When I was diagnosed, I was 44. I had 2 little children, and now I'm 66. It'd be a whole new journey for me. It'd be so different. And even the whole system now, when I was diagnosed, that there was the hospital I was at, big hospital, and the whole top floor was oncology. So you stayed there, and people looked after you, and you made it through, because I often think about, I could look after myself. I do that now. But when I was sick, my life was in other people's hands. And I think about, how lucky I was, even though this might sound strange, but to be at that time when you could stay at hospital.
Yeah.
And you got looked after, and that you got the, like now I see people going in having day treatment, and it must be so tough. That's where you need to be able to talk. And for Aboriginal people, we have yarn up circles, and yarn up circle is a trusted circle where we can all meet, we can sit down, we can have a yarn, and that, I used to facilitate men's yarn up groups, and I needed as much as any man that came along. So yeah, it's just to be able to talk to other people, to sit down, have a yarn, is so important.
Thank you, Garry, so much. You guys have been sensational. There've been incredible number of questions, really thoughtful, beautiful answers. And unfortunately, we're over time, so I'm going to throw back to Linda. So thanks, guys.
But as we come to a close, I'd like to draw your attention to Blood Cancer Awareness Month, which is held each year in September. So Blood Cancer Awareness Month is a global event helping to raise awareness of one of the world's most prevalent and dangerous cancers in blood cancer. So 53 Australians are diagnosed with blood cancer every day. And despite this, awareness of the disease is still incredibly low. So this September, Leukaemia Foundation is firmly focused on connecting Australia's blood cancer community, that's you, with a strong message that you're not alone. We'd like to share this video to let you know about what it is that Leukaemia Foundation can, how Leukaemia Foundation can support you through the blood cancer experience.
The Leukaemia Foundation is here for you every step of the way as you and those closest to you navigate blood cancer. Engage with a highly skilled blood cancer support expert to access the latest information, supportive care services, and to connect with your blood cancer community. No matter where you live or what stage of blood cancer you are at, we are here for you.
We are the people at the end of the phone or computer when you first contact us here at the Leukaemia Foundation. I am here to listen to you, understand your concerns, and discuss how we can help you with your specific needs.
Our blood cancer support coordinators are here to provide you and those around you with the ongoing support and information you need throughout the blood cancer experience. If you're unsure where to turn, we can support you. Whether you're seeking a listening ear, guidance, reputable information, or connection to others with blood cancer, we're here.
The pathway of a blood cancer diagnosis can bring many losses, one of the most challenging being the death of a loved one. Bereavement counselling, information and support is available to you at this time.
Feeling connected is really important here at Leukaemia Foundation. We offer online support groups, educational webinars and private Facebook pages. We also have our podcast series Talking Blood Cancer. All of these are really great opportunities to learn and connect with others who know what it's really like to live with blood cancer.
We are here to help you manage the practical challenges you face with blood cancer, from getting you to and from medical appointments to accommodation if you need to relocate for treatment.
We're championing the needs of people living with blood cancer, from raising funds for life-saving research to advocating for coordinated national efforts. We're also improving survival and quality of life for people diagnosed with blood cancer.
We encourage you to connect with our experienced blood cancer support experts Monday to Friday from 10 a.m. to 4 p.m. Australian Eastern Standard Time on 1800 620 420 or anytime via bloodcancer.org.au.
Really, the message is around, connecting in with us, and please make yourself known to our services via our email or our 1800 number. On that note, we'd like to really warmly extend an invitation to our online support groups for this month, which is on the topic of fear of recurrence, something we covered today. And those groups are a really wonderful way to be able to connect with your peers, to talk at a much more private and deeper level around some of those worries and fears associated with blood cancer recurrence. They're facilitated by our blood cancer support coordinators and are fairly small in nature, so it is a safe environment for you to share your experiences. And you can register for those by going to our events calendar on the Leukaemia Foundation website. Finally, thank you to our guests again, both Charlotte and Garry, for your generous time, knowledge and expertise. It has been incredible. And to the audience, we'd invite you to really take what you've heard and learnt today into your own lives. Thank you so much again for joining us. Go well, and bye for now.